Thank you for joining us for the Parenting at Mealtime and Playtime webinar. The Ohio Chapter, American Academy of Pediatrics, operates this program with the financial support of the Ohio Department of Health. The Parenting at Mealtime and Playtime program, also known as PMP, has continued to evolve over the past several years to offer the best possible resources to you and the families you serve. Today we are excited to share more information on programs in Ohio. Today you will hear from 3 different experts in breastfeeding. First, we will hear from Dr. Vanessa Shanks, the Medical Director of Neonatal Lactation Services with the Ohio State University and Nationwide Children's Hospital. Dr. Shanks will describe the benefits of breastfeeding and why we should encourage mothers and families to breastfeed when possible. Bree Haviland, a registered dietitian and certified lactation consultant with the Ohio Department of Health, will describe how you can support as a home visitor or community health worker, and when you can refer to an expert. Finally, Megan Richardson will talk about how WIC can assist your clients and who to reach out for further assistance. The Parenting at Mealtime and Playtime program is here to support you as you support Ohio moms, dads, caregivers, and our state's youngest citizens. We have created some great resources that can assist you as you educate families on healthy habits. Our breastfeeding handouts and introductions to solids handouts that cover feeding cues for parents to identify. Our breastfeeding handouts and introductions to solids handouts that cover feeding cues for parents to identify. The easiest way to access our resources is through the Ohio AAP website. This is available for all public health professionals at no cost and no login is required. When you visit the website, www.ohioaap.org/PMP-resources and click the box that best suits your role. This handout will assist in sharing important information on baby hunger cues. The breastfeeding handout includes information that mom's self-care and heading back to work. We have also included milk storage information as a guide. The Transitions to Solids, a guide to baby-led weaning, shares information with the caregivers on when a baby is ready for solids. It supports the transition to an exclusive breastfeeding routine to introducing new solids and how to begin this introduction. The Parenting at Mealtime and Playtime also offers age-specific handouts that describes nutrition, activity, and sleep recommendations and tips for each age group. Our youngest age group handouts also include some information on the importance of breastfeeding. Our mobile app has other resources that may be helpful for you or your clients. This mobile app is free for download in the Google App Store. When searching for the app, search for Parenting at Mealtime and Playtime rather than PMP to be sure to find the correct mobile app. To sign up for an account for the app, please follow the instructions here. You will create an account in order to receive helpful reminders and messages for you and your baby. Our first presenter is Dr. Shanks. Welcome, Dr. Shanks.
Hi, this is Vanessa Shanks. I'm a neonatologist and the Medical Director for Lactation Services at Nationwide Children's Hospital, and I am here today to talk with you about breastfeeding. The first thing I want you to know is that 90% of women want to breastfeed. We know this based on a recent survey from 2016 that was handed out to women who had recently delivered a baby. We also know this because the majority of women will breastfeed up to a month. We have high initiation rates in the United States, which tells us that women want to breastfeed. Despite this, only 57% of infants are breastfed through 6 months, and only a quarter of infants are breastfed exclusively through 6 months, which tells us that we are failing these moms and babies somewhere after that initiation period. This same survey asked women what they want to hear in breastfeeding counseling, and one of the primary themes was that they want to know that breastfeeding is not the best way to feed their baby, but the normal way to feed their baby. We need to think of breastfeeding as the gold standard and the default, and not put it in a hierarchy that is considered best. These women also want us to be realistic with our counseling. They don't want to hear horror stories, but they want to be aware of the challenges they may face before they run into them. They also tell us that we need to educate their family members and not just mothers themselves. When we leave their house, these mothers will turn to their family members, friends, and partner for support and guidance. So we need to make sure that they are on the same page and are all getting the same message that we are giving to mom. If we don't do this, then when something comes up, mom might hear conflicting advice from her trusted family member, which puts her in a tough spot, and we want to avoid this. Over the next few minutes, we will review the benefits of breastfeeding, some common pitfalls that moms experience that prevent them from being successful, and understand the importance of mom's support person. We'll also learn which red flags to watch for and review ways we can support mom's breastfeeding efforts. Most women know the benefits of breastfeeding for infants. We have done a very good job of educating the public that infants will experience fewer illnesses if they are breastfed. There's also newer research looking at the risk of asthma being lowest with direct breastfeeding compared with expressed breast milk. Fewer moms understand the benefits for herself. There is a lower risk of breast and ovarian cancer, as well as diabetes and heart disease, if mothers breastfeed. Particularly for mothers who might have a family history of these illnesses, this can be very important information and can also help to get mother's family understanding the importance for her own health. If moms achieve their breastfeeding goal, there is less postpartum depression, which also emphasizes the support that we need to give these mothers. Many women are aware of the benefits of breastfeeding for an infant's health. We have done a very good job educating society that infants who are breastfed experience fewer illnesses, and newer research shows a lower risk of asthma with infants who are directly breastfed compared with expressed breast milk. Fewer moms are aware of the maternal benefits of breastfeeding. Women who breastfeed can experience a lower risk of breast and ovarian cancer, as well as diabetes and heart disease. This information can be very important in helping the family understand why breastfeeding is also beneficial for mom's health, as well as the infant's. If mom achieves her breastfeeding goal, there is also a lower risk of postpartum depression, which can be very important. Few moms are aware of other benefits of breastfeeding, and our recent survey shows us that they want to learn more about these benefits as well. There can be improved infant bonding. There's less washing if you're not having to give a baby a bottle. And breastfeeding can be more convenient when you're out of the house. You don't have to worry about packing bottles, packing formula or expressed breast milk, and ensuring it's at the appropriate temperature. It's important when you're talking with moms about these benefits to make sure that they understand that these are not immediate benefits in the newborn period. These are benefits that she can expect once breastfeeding is established, but may be more difficult in those first couple weeks. There are several common pitfalls that women experience when they are learning to breastfeed. Pain is probably the most common problem that women encounter when learning to breastfeed, and is also one of the most common reasons that women stop prior to their intended goal. If you remember nothing else, please remember that pain is not normal. If a woman describes mild tenderness or a little sore when the infant first latches, that may be normal. But any description that involves the word pain is not normal, and is most often due to a shallow latch, which can usually be easily fixed. If a woman describes pain during breastfeeding, I encourage you to ask her to rate it on a scale of 1 to 10. Anything greater than a 2 or 3 should not be considered normal. Breastfeeding should be completely pain-free within a few seconds of the infant latching, and if that is not the case, please encourage her to seek help from her pediatrician or a lactation consultant. Many women think that pain is a normal part of learning to breastfeed, but this is not the case, and she does not need to suffer while she is learning how to do this. Another common pitfall is perceived low milk supply. This is the most common reason for early supplementation and the second most common reason for early weaning prior to mom's goal. True low milk supply is very, very rare, but the perception that a mother has low milk supply is very common. This is because many normal newborn behaviors are misinterpreted as hunger cues, and if a mom is breastfeeding, then these misinterpreted cues are presumed to be due to a low milk supply. This is often not the case. It's important to follow an infant's outputs and weights so that you can provide reassurance where appropriate or refer to a professional if there is any concern. Many moms will plan to breastfeed and bottle feed so that they can involve the dad or partner. The best way to counteract this is to involve mom's partner with breastfeeding. Encourage the partner to attend medical appointments and lactation consultant visits. If they also are learning how to help mom breastfeed, then they can be a second set of eyes and hands and be part of the breastfeeding experience with mom, instead of replacing mom and offering a bottle. In those early weeks when baby seems to be more sleepy, dad or partner can help to keep the baby awake at the breast, can get pillows for mom to be more comfortable, or can be a second set of eyes to look at the latch and determine if it looks different from a different perspective and maybe is not as deep as mom might think it is, and be a source for her pain. It's also important for us to remember that dad is the most influential person for mom's success. Based on research, if dad is supportive of mom's breastfeeding efforts, she is more likely to be successful. Whereas if dad is not on board, then she will not be successful. We currently do not have research on same-sex partners, but we can expect that when that is available, we will find similar findings. Returning to work is another very common and real concern for these moms. I recommend mothers to schedule a lactation consultant visit about 4 to 6 weeks before returning to work. It's very important for these moms to talk with their boss prior to this appointment so that they can begin to troubleshoot any perceived barriers prior to returning to work. Pediatricians can also write a work note explaining the time that mom will need in order to express her milk. While employers are obligated to provide this time and space, most of them do not know the specifics needed, and a simple note explaining what mom needs can be very helpful. Another common pitfall is lack of support. These moms cannot have too much encouragement and support. It's important to help mom identify people in her support network and resources in her community. There are a couple of red flags that I want you to be aware of so that when you are seeing these mothers, you can give them advice when it is time to seek professional help. Stool output is more reliable than urine output. An easy way to remember the appropriate stools that we expect in a breastfed infant is that the number of stools should match the number of days of life in the first week. So on day 2, we should see 2 stools. On day 3, we should see 3 stools. We should see the stool transition by day 4. If any of that does not seem as expected, it is important to encourage mom to schedule an appointment with her pediatrician and a lactation consultant. Following the baby's weight is another important part of the physical exam. If a baby has lost more than 10% from birth, that would be a concerning sign. If the baby has not regained birth weight by 2 weeks, that would also be concerning, but is not always indicative of a problem. These are indications that the baby should be seen by a medical professional to assess whether or not a problem exists. The last red flag, again, is pain. If mom is experiencing any pain with breastfeeding, it's important for her to seek help early. Many moms will plan to wait it out and see if it gets better in a couple of days, but I would discourage this. Most likely, if mom is experiencing pain, there is a problem with the latch, and if it's not corrected, it typically will not fix itself. It's very important to support mom and congratulate her on her efforts, regardless of how breastfeeding is going. These moms need a cheerleader in their court, and that is something that you can do that she may not be getting from family or friends. It's important to encourage mom to seek help early with any red flags. Letting these problems continue is only going to make things worse. Inform mom that the first 2 weeks are the hardest, and if she can get through those 2 weeks, things will start to get a little bit easier. It's important to involve dad and a partner, educate them on how important they are for mom's success. Many dads do not realize how influential they are. In this day and age, many moms will turn to technology for help and support as well. Making sure that they are looking at good, reliable resources is also important, and I recommend the Stanford breastfeeding videos, which are available for free online, as good resources for learning how to breastfeed with a good latch, hand expression, and pumping. Lastly, it's important to remind mom that breastfeeding is not a destination. She does not decide to breastfeed and then just do it. Breastfeeding is the journey itself. There's going to be ups, there's going to be downs. She's going to move forward some days, and she's going to get pushed back other days. And many women don't realize this. But it's very worth it.
Hi, this is Bree Haviland with the Ohio Department of Health, the Title V Breastfeeding Coordinator, and today I will be talking about working with families and practical guidance. In this presentation, we are going to talk about conversations with families around breastfeeding, common breastfeeding questions and concerns, the importance of fathers or partners, and resources and additional support. You may not be a breastfeeding expert, nor are you expected to be. Today's presentation will provide you with a better understanding of working with breastfeeding moms and the resources available to provide them. When talking with families about breastfeeding, let them know you are supportive. Ideally, we want moms to breastfeed exclusively for 6 months and continue for a year, but any amount of breastfeeding is better than none at all. Even if you're not a breastfeeding expert, showing your support to a mom's feeding decision is important. Talk with the family about the importance of breastfeeding and share some of the benefits for both mom and baby. Remember, breast milk protects babies from illness. Formula-fed babies have higher risks for sudden infant death syndrome, or SIDS, ear infections, respiratory infections, asthma, diabetes, childhood cancers, and obesity. For moms, the benefits include lower risk of health problems such as type 2 diabetes, breast cancer, ovarian cancer, and postpartum depression. Another benefit is bonding. Breastfeeding keeps mother and baby close. Physical contact is important to newborns. It helps them feel more secure, warm, and comforted. Mothers also benefit from this closeness. Breastfeeding can also save money. Formula and feeding supplies can cost well over $1,500 per year, depending on how much a baby eats. Since breastfed babies are also sick less often, there are fewer trips to the doctor. And finally, share resources and refer your families to breastfeeding experts when they need help. Let's talk about common questions and concerns. The content in this section was taken, with permission, from Breast for Success, a program at university hospitals in Cleveland that was developed to educate new mothers and fathers about breastfeeding and to help them be successful in breastfeeding their newborns. Breast for Success offers a variety of tools and resources for the whole family, and there is a specific curriculum for community health workers and home visitors. It was developed in partnership with University Hospital, Rainbow Babies and Children Hospital, Moms First Home Visiting Program, and Cuyahoga County WIC program. The link to Breast for Success is available on the resources slide at the end of the presentation. The following slides will go through a list of common questions or concerns and appropriate responses for you to provide the family you're working with. The first question we will go over: can every woman breastfeed? In general, yes. Breastfeeding is natural, but many women need some extra help. Women who use street drugs or have HIV should not breastfeed. Is breastfeeding hard? Does it hurt? There may be pain or soreness during the first 2 weeks of breastfeeding, as the nipples and breasts are not used to the baby feeding. You can help ease the pain by helping the baby achieve a deep, comfortable latch. Use different positions to feed, and don't be afraid to ask for help. The images here depict different breastfeeding holds. Breastfeeding should not hurt. You will feel tugging and pulling, but pain is not part of breastfeeding. About 2 to 5 days after you deliver, your milk will come in, meaning you start making a lot more milk and your breast will feel full. It takes about 3 to 4 weeks to establish a good milk supply. My breasts are too small or too large. Can I still breastfeed? Breast size and breast shape do not have anything to do with the amount of milk. Milk production is based on supply and demand. The more the breast is emptied, the more milk it makes. My breasts are large. Could I suffocate the baby while breastfeeding? When your baby latches onto the breast, the baby's nose protects his or her breathing and lets air in and out no matter how big the breast is. Remember, a rollover accident while sleeping can suffocate the baby, so you need a safe sleep space for the baby. You can breastfeed while also ensuring a safe sleep space for baby. The recommendation is room sharing without bed sharing. Remember the ABCs of safe sleep: alone, back, crib. The infant's crib or bassinet or pack and play should be in the parent's bedroom, close to the parent's bed. This is room sharing without bed sharing. This makes breastfeeding easier at night. You can reach over, hold the baby and breastfeed, then safely put the baby back to sleep. The Ohio Department of Health, in partnership with the Ohio Hospital Association and the First Steps for Healthy Babies team, created a breastfeeding safe sleep handout. It is available in Spanish, and the link to this handout is included at the end of this presentation. I will be really busy with work and school. How will I breastfeed? The thought of breastfeeding might seem overwhelming at first, but there is a lot of flexibility. Any amount of breast milk you can give your baby is a good thing. You can breastfeed in person whenever you and the baby are together. You can either pump or express milk by hand when you are not there. If you will be away less than 4 hours, you can breastfeed before and after you get home. Talk with your teacher or supervisor about your decision to breastfeed. If you can't be with your baby, ask for a private space that is not a bathroom to pump. The federal law requires an employer to provide reasonable break time for an employee to express milk for her nursing child for 1 year after the child's birth, each time the employee has a need to express milk. The employer is not required to compensate an employee receiving reasonable break time for any work time spent for such purpose. The employer must also provide a place other than a bathroom for the employee to express milk. The federal law only applies to hourly, overtime eligible employees. but many employers accommodations for all staff. The Ohio law states that a mother is entitled to breastfeed her baby in any public location where she is permitted. Will I need a breast pump? You may or may not need a pump depending on how long you'll be away from your baby. Many women don't express milk at all and breastfeed from the breast only, and some women choose to hand express their milk instead of using a pump. How do I get a pump if I want one? Check with your health insurance provider about getting a free pump. Your local WIC office can also help you in getting a pump and also in using the pump. And finally, your doctor's office should also be of help to you. Do I need to cut certain foods out of my diet? The variety of foods you eat flavor your milk, exposing your baby to different tastes, and babies love this. It's always good to eat healthy, but your milk will be perfect for your baby no matter what you eat. You will feel better and have more energy if you eat well, including fruits and vegetables, protein, whole grains, and low-fat dairy. Babies may get gas from some foods, but this is normal. Some babies may be sensitive to something you eat, such as eggs or dairy products like milk or cheese. This doesn't mean your baby is allergic to your milk, only just something that you ate. You can continue to breastfeed, you just may want to remove whatever food you were eating that bothered your baby. And remember, babies cry for a lot of reasons. Crying does not mean there is something wrong with your milk. Will I lose my pregnancy weight faster if I breastfeed? You will burn an extra 400 to 500 calories every day you breastfeed, which means you can lose a pound a week just from breastfeeding alone. Can I still breastfeed if I take medications? Many medications are okay to take while breastfeeding. Talk with your doctor or pharmacist about your medicine specifically. The National Library of Medicine offers an online tool to learn more about the effects of medicines on breastfed babies. You can use this link and talk with your doctor or pharmacist. I smoke cigarettes. Can I still breastfeed? Yes. All women should be encouraged to breastfeed, including those who smoke cigarettes. It is best to quit as soon as possible. The benefits of breastfeeding outweigh the risks of the small amount of nicotine in the breast milk of smokers. Babies of mothers who smoke are more likely to get respiratory or breathing infections and have a higher risk of SIDS, or sudden infant death syndrome. Babies of mothers who breastfeed are protected against respiratory infections and have a lower risk of SIDS. Also, it is important to smoke away from the baby and change your clothes afterwards to keep the baby away from the chemicals that smoking leaves behind. Do I have to stop drinking? It is best to avoid alcohol in large amounts. You should not feed your baby when you are drunk or buzzed. You can pump some milk before having a drink or two and give that milk to the baby until the buzz is gone. It is recommended to wait 2 hours or more before breastfeeding. It's also important to make sure someone is there sober who can take care of the baby, because taking care of the baby is the biggest concern. If I want my baby to take bottles and formula in addition to breastfeeding or breast milk, when do I start? It is recommended to wait 2 to 3 weeks before offering a bottle. This way your breast milk supply will not be at risk. Also, the baby will get really good at breastfeeding before you give him or her a bottle. You can offer both breast milk and formula. Ask your doctor which formula is best for your baby. Giving your baby formula may cause him or her to not want as much breast milk, and this will decrease your milk supply. How do I make sure I have enough milk for my baby? Feed often, every 2 to 3 hours. You have to empty the breast so that they know to make more milk. Feeding formula gets in the way of making milk because the baby sucking does not get a chance to tell the breast how much milk he or she needs. How can I tell if my baby is getting enough milk? Your breasts feel full before a feeding and soft afterwards. You can hear your baby swallowing during feeds and see milk in your baby's mouth. Your baby is satisfied and calm between feedings, and you notice plenty of wet and dirty diapers. A newborn stomach is the size of a cherry on day 1 and increases to the size of an egg by day 10. As breastfeeding is established, exclusively breastfed babies from 1 to 6 months of age will take between 19 to 30 ounces of milk per day. Older babies take less breast milk as foods are introduced. And remember, every baby is different. You can also use a feeding chart to track how long the baby feeds at each breast or the amount that is taken if the baby is drinking express breast milk from a bottle. Research shows fathers make a big difference for their babies and their baby's mother when they support breastfeeding. As a home visiting professional, make sure that you are acknowledging the father, partner, or support person. It's important that he or she feels valued by you as well. A common concern is that the baby's father or mom's partner will feel left out if she chooses to breastfeed. We will spend the next couple slides discussing the many things a support person can do, and that's not just changing diapers. No father or partner is left out. Breastfeeding increases the closeness of the family. As I mentioned, a lot of the content in this presentation is adopted from the Breast for Success curriculum. When developing the Breast for Success curriculum, it was important to have a section specifically for fathers and partners. A group of 5 expectant and/or experienced fathers came together for a 2-hour focus group to explore perceived interest in breastfeeding, attitudes, and social support. A second group of 5 expectant and/or experienced fathers previewed and discussed the potential Breast for Success curriculum during their 2-hour focus group. The conclusions from these focus groups include: participants were very interested in breastfeeding, but felt left out of the decision-making process, suggesting that fathers are an underutilized breastfeeding resource. Men may feel unempowered because they lack specific breastfeeding knowledge, are unsure of their role in breastfeeding, or because they have difficulty navigating relationship issues, which impacts initiation of these discussions. Participants believed there is insufficient programming for them, suggesting a need for father-centered interventions focusing on the father's role, including education about breastfeeding basics and practical ways fathers can troubleshoot common breastfeeding challenges. Participants were also concerned about the impact of smoking on breastfeeding, the content of formula in breast milk, and the effect of breastfeeding on intelligence and behavior. Given the results of the focus group, the Breast for Success curriculum has many tips on engaging and involving fathers or partners. These include: before the baby arrives, attend prenatal visits with mom, thank him or her for coming and be understanding if he or she can't make every appointment, attend ultrasounds, be inclusive in infant feeding choices, attend WIC appointments and classes, have a conversation about feeding. Mom shares what she knows about breastfeeding benefits. Mom asks her baby's father or partner what he or she knows about breastfeeding and what he or she wants to learn, and ask him or her what he or she thinks about formula feeding. After the baby is born, the father and partner can bathe the baby, hold the baby skin to skin, carry the baby around when fussy, talk and sing to the baby, and read to the baby. Other ways to help: they can help care for other children, ask mom if she wants something to eat or drink and go get it, run to the grocery store, help clean up the house or apartment, and support mom in front of friends and family. Politely say no to family and friends who want too much visiting. Politely say no to grandma who wants to give bottles. Politely say no to family and friends who want mom to go to church or parties and events when she really just wants to stay home with her baby. As a home visitor, acclimate yourself to your local breastfeeding resources. It's important to know who to refer to for more breastfeeding help. These include your local WIC office, the lactation department at your nearby birthing hospital, mom-to-mom support groups such as La Leche League, and also the pediatrician's office. Helpful resources where you can find more information include the Ohio Department of Health, the Help Me Grow program, the WIC program, and the Infant Safe Sleep program, the Breast for Success curriculum, where much of the content was taken from this presentation, the American Academy of Pediatrics, educational resources for health professionals, including an extensive list of books, websites, and PDFs, policy statements and guidelines, and training materials and promotional materials. The womenshealth.gov website that covers many tips and suggestions to successful breastfeeding, including why it is important, challenges, finding support, breastfeeding in public, going back to work, and pumping and milk storage. And also within the womenshealth.gov website is a great booklet called Your Guide to Breastfeeding that is a go-to breastfeeding guide covering latch and positions, common challenges, breastfeeding in public, and other breastfeeding concerns. It has a little bit of everything that you need to know. The Ohio Breastfeeding Alliance has a website that includes a variety of resources and tools you need to protect, promote, and support breastfeeding in your community. The La Leche League of Ohio group can help you locate a group and a La Leche leader near you. The National Breastfeeding Helpline is available from the Office on Women's Health and has trained breastfeeding peer counselors to help answer common breastfeeding questions. It is available for all breastfeeding mothers, partners, prospective parents, family members, and health professionals. The helpline is open between 9 a.m. and 6 p.m. Eastern, Monday through Friday. If you call after hours, you will be able to leave a message, and a breastfeeding peer counselor will return your call the next business day. Help is available in English and Spanish. If you have any specific questions, feel free to contact me with the information listed on this slide. Thank you.
Hello, my name is Megan Richardson with the Ohio Department of Health. I am a registered dietitian and certified lactation counselor and currently the breastfeeding coordinator for the Ohio Women, Infants, and Children program, also known as WIC. I am going to be sharing with you how breastfeeding is supported through the WIC program and how knowing this information can support you and your clients. Breastfeeding promotion and support are integrated into the education that all pregnant participants receive when participating in the WIC program. The choice of an infant feeding method is an important component of preconceptual and prenatal counseling. WIC staff are required to provide accurate infant feeding information in a culturally competent manner and support the mother in her choice. The education is provided by local WIC staff, including health professionals, breastfeeding coordinators, and breastfeeding peers. All staff in the WIC clinic have received some extent of breastfeeding training to ensure breastfeeding is promoted and supported throughout every interaction as applicable. Each breastfeeding coordinator is either an IBCLC or has completed a 5-day course, such as lactation, certified lactation counselor, or specialist. An IBCLC, or internationally board-certified lactation consultant, is a healthcare professional who specializes in the clinical management of breastfeeding and provides leadership, advocacy, professional development, and research in the lactation field. Every project has a breastfeeding peer helper program, which we will talk about more soon. Infant feeding discussions are presented in a way that does not force the mom to choose her preferred infant feeding method before her concerns are addressed. It is important to assess the pregnant mother's knowledge base and extent of breastfeeding experience while utilizing the patient-centered counseling approach. Benefits of breastfeeding to the infant and mother are shared while targeting her individual needs. All pregnant women are provided information on the importance of skin-to-skin contact after birth, instruction on hand expression, and education on initiating and maintaining breastfeeding if she decides to breastfeed. Ohio WIC has many educational materials available. All prenatal women receive the How to Breastfeed Your Baby booklet, which includes a vast array of helpful information from different holds, information and photos on hand expression, and illustrations of the size of a baby's belly, all the way to addressing issues that may arise, including engorgement, thrush, or others. All WIC clinics also have an engorgement plan in place, so if a participant calls with this issue, each staff member has information to help, even if breastfeeding staff are not available at that moment. If this were to occur, follow-up would happen within a timely manner to support the mom. Materials and fact sheets are also available. You can contact your local WIC office for access to these materials. These educational materials are created through the help of our Nutrition and Breastfeeding Advisory Committee, also called NABAC, where local breastfeeding experts from different regions in Ohio that also work with the WIC program come together. Current fact sheets include the topics of plugged ducts, mastitis, and the group is currently working on the topic of thrush. Examples of additional materials created through the NABAC committee are Calling All Dads and Be Their Breastfeeding Champion. As we know, support is a major factor in breastfeeding success. These pamphlets encourage support by dad, other family, friends, and community members. Another helpful resource that WIC can offer is the Human Milk Storage Guidelines for Healthy Full-Term Babies. The Ohio WIC program also has a breast pump program. Pumps can be provided to mothers and their infants who are certified through the WIC program and are part of a breastfeeding dyad. The Affordable Care Act requires most insurance plans to cover the cost of a breast pump, but there are many instances where receiving a breast pump from the WIC program is an option. Ohio WIC policy states that manual pumps are available to be issued to participants who are separated from their baby for any length of time or whenever deemed necessary by the local WIC breastfeeding coordinator or other designated staff. Mothers who will be separated for fewer than 4 consecutive hours should be taught hand expression and provided a manual pump. Electric pumps may be provided to mothers to initiate and/or maintain a milk supply. Single-user electric breast pumps may only be given to mothers who are certified as exclusively breastfeeding and are not receiving formula from the WIC program. Single-user electric breast pumps can be given to participants who have a well-established milk supply and are planning to return to work or school full-time or part-time with anticipated separation from baby for 4 consecutive hours or more in a given day. Another type of loaner pump is also available through WIC. Only pumps approved by the Food and Drug Administration, or FDA, as multiple user pumps may be loaned to participants and reissued to other mothers with a new attachment kit. The same standards apply as the single-user electric pump. Lastly, the hospital-grade pumps that WIC offers are most effective at initiating and maintaining lactation for mothers whose infants are too young or weak or have other disorders that do not allow them to nurse at the breast and/or while breastfeeding problems are resolved. Hospital-grade pumps are classified as multi-user pumps and can only be loaned to WIC participants. A new attachment kit is provided with each loaned pump. The Ohio WIC Breastfeeding Peer Program is an exceptional program that meets with all prenatal and breastfeeding participants. The breastfeeding peers provide mom-to-mom support. Each of the peers are either current or former WIC participants who have successfully breastfed their own infant. They give basic breastfeeding information and support to other moms, such as tips for how to breastfeed comfortably, even in public, ways to stay close to their baby through breastfeeding after returning to work or school, ideas for getting support from family and friends, ways to get a good start with breastfeeding, tips for making plenty of breast milk for your baby, and help with breastfeeding concerns. WIC peers are excellent at working with moms and meeting them where they are in life. They have the support system to refer moms to the breastfeeding coordinator for complex breastfeeding challenges. The Breastfeeding Peer Program is available in every WIC program in all 88 counties in Ohio. As you work with breastfeeding peers throughout Ohio, you may notice materials that USDA has shared. They refer to breastfeeding peer counselors. This is the same program that is implemented in Ohio. To comply legally with the state's Ohio Revised Code, the term counselor cannot be used for breastfeeding peers in Ohio. We look forward to you using these materials and getting in touch with your local breastfeeding peer. For additional information on the Ohio WIC program, visit odh.ohio.gov and search for WIC. You will find helpful information about the program and access a clinic directory in order to reach out to your local WIC clinic. You can also visit wicbreastfeeding.fns.usda.gov to view the WIC breastfeeding support campaign and to access additional breastfeeding support materials. Lastly, visit womenshealth.gov for additional information on the breastfeeding helpline that is offered. You may find yourself referring families to this resource. Please note my contact information and feel free to reach out to me if you have any additional questions regarding the WIC program in Ohio. Have a great day and thank you for all that you do.
We sincerely appreciate you spending your time with the Ohio AAP to learn more about these important topics impacting children's nutrition and play. You can access the Parenting at Mealtime and Playtime resources on our Ohio AAP website. Thank you to our presenters for all they do for the Parenting at Mealtime and Playtime program and for Ohio's children. If you have any questions for Ohio AAP, please don't hesitate to call us at 614-846-6258. A big thank you to you for your ongoing efforts to assist Ohio's families.